Hi, welcome back, everyone. Let's get everyone connected and settled in. Right. Did you get a note that says this session's in a recording when you popped into this room? Okay, perfect. All right, let me pull back the screen. Okay. So as I understand, we're in here until about 11:40. So we have 40 minutes to go over our last two sections. We started out looking at our strengths and our opportunities. We're going to go ahead and focus these next two on the challenges that you see and then what the priorities should be. So after we've taken all this information into account, thinking about our strengths, cross-sector opportunities, challenges that may be ahead, what are the priorities that we're going to focus on? So let me go ahead and put your Jamboard link back in just in case you closed out. We're still using the Jamboard we were on, but let's make sure we navigate to the top here and we go to number 4. So it should say challenges in yellow or orange font at the top.
Dane, I'm going to pause you for just 1 second.
Sure.
I realized this as we were taking a break. I did want to ask if anyone would be interested in doing the share out for this group. So it'd be a short summary of what we discussed. Zane can bring up this Jamboard so you can see it for refresher. But I would love for one of you that are participating to be the ones to share out what we've discussed.
I can do it, Shelley.
Thanks.
Jody, thank you, Jody. All right. Yeah, thanks for taking care of that, Shelly. You probably got stuck on one of us. Good call. All right, everyone, let's go ahead and jump into challenges. Question here for you to think about. So when you're thinking about access to physical activity, what challenges might you need to be prepared to overcome? We'll do the same thing we did with the other two. Let's reflect individually. If it helps to make notes, make notes. If you're able to think about it and keep a list in your head. And then eventually, someone's starting to share already. Eventually, I'll ask you to get your ideas up on the board. But let's go ahead and think individually for a second. Question is in the chat. Hope you're getting a good list of challenges that you're wanting to share with the group, things we should be thinking about as we move this work forward. If you feel like you're at a pretty good place, go ahead and pick your top 2 or 3 that you think are the most important, and let's start getting those on our Jamboard. We've got funding, transportation, getting the word out, access, money, transportation's on there 3 times. Oh, competing priorities. I would love to hear more about that one. Motivation. You got your ideas on the board. Take a moment to see what teammates in this group shared. And then let's hear about what stands out to you. Anything that's new information, things that have been challenges since the age of time. Funding's a new one, right? Just kidding. Anything standing out? Anything you didn't expect to see on the board?
And there's definitely recurrent themes here, right?
Yes. And what does that say? That challenges always seems to be one that folks are really in line with each other on. These are the challenges we face no matter what organization or sector we're in. In fact, I think with that, the argument can be made that that's why cross-sector collaboration is so important, is because those big overarching like evil challenges are shared throughout organizations and sectors.
Yeah, I mean, transportation, right? If you could cross sector with bike walk KC, bus systems, you know, that would be helpful for getting our patients to where they need to go.
Adding a note back into opportunities there.
I did it again.
Are you on the third board?
I think, was I? I don't know. Let me go back to your board and see.
Okay.
Oh, maybe oh, there we go.
There
Okay,
you go.
it's just behind another one. I thought, oh, dang it.
I'm not going to pick on the person who shared the sticky note because I think anybody in this group could answer it. I am interested in hearing any more information if you want to share about how competing priorities are a challenge. Does anyone have anything? Yeah.
Well, here's a little bit about what I think about that. So, in terms of improving, let's see, how do I want to think about this? This is about access to physical activity. And I think, so maybe this is in the wrong one, the way I'm thinking about this, but competing priorities. So if you've got multiple kids or multiple family members who want to participate in a physical activity opportunity, if they all want to do different ones, and they happen at the same time, how are you going to get there? How do you make that happen? And so that's one. And then the other one I think about is the priority between school and physical activity, or homework and physical activity, or anything else related to that. It could be family obligations or responsibilities. It could be, we have engineered physical activity out of our society, and so that we don't think about these things together.
Yeah, when you said that, sometimes my mind makes weird solutions that may not work, but I was like, well, what kind of homework can you do that would be a physical activity? What kind of homework can schools help kids so that they're not sitting at the dinner table all the time writing on paper, but also doing physical activities as homework? But yeah.
Or how about not send them homework home?
Well, that's my vote, but
how about, I mean, especially in certain age ranges, why should elementary school kids have homework? And then middle school, are there better ways to educate during the day and focus on it during the day so that when they're home, it's activity. Now, high school, I mean, I get that's going to be a little bit different. That's going to be a little bit more challenging. But if we started where it makes the most sense, then we don't have that as a competing priority.
Does the physical activity plan stakeholder group have a route to make that kind of influence, to be that kind of cultural shaper?
So not yet, but my hope would be that we do. In fact, at the school sector special event that just happened yesterday, we had quite a few PE teachers who participated in it, which was quite exciting. And one of the things that they brought up that stuck out to me was the people who have the most influence in schools are parents. So their ability to change policies within school districts is the highest. And parents may not think they have a voice. They may not understand that when they get together and say something, the district listens, and that actually changes practice within their district. That may not change it across the world, but if you start in some districts, other districts look to another one that might have tried something that they might be hesitant to try themselves. They're looking to other people to demonstrate effectiveness before they make a change. And so I think one of the things it made me think about is maybe we're hitting the wrong audience, or maybe we're missing an audience, and maybe we need to be more active with parents.
So I was just going to ask this question to the group because you brought up parents. I think that's helpful and useful. If we were talking about parents, either parental engagement or parents as partners in this work, is that something that we put under a strength right now? Is it something we put under an opportunity, or is it something that is a challenge? Is there from your sector, is there?
I'd say an opportunity.
That's an opportunity.
I would say yes. All of them. I think here's the other thing I think about. And I'll speak about myself. I often come to the table representing an organization, forgetting the fact that I'm also a parent and, family member and, member of a church and all of the other things that, we are. And I think maybe reminding ourselves that, hey, we can come at this in a number of ways.
Like it. That's great. Folks, are there other things that are standing out on the challenges board? Are there any challenges that we should add if we think back to the work we just did on cross-sector opportunities? So we identified some opportunities. I'm sharing my screen. If you're looking, I can go back. Anything that we would say, hey, this is a great opportunity, but we need to be aware of this challenge to getting to this opportunity. It might be the example of sharing better programming information with patients at the source.
That's what I was going to say, connecting the opportunity to the challenges. If you guys can send me some examples of physical activity programs that you guys are engaged with right now or know about, then I can start to compile a list that I could potentially hand out to my patients. And like I said, we could reach a lot of patients that way because there's about 30 providers in our clinic. So,
the other thing I think we're not taking advantage of, and I don't know why, because I don't understand the technological issues with this, but we're driving patients to using portals. So accessing their own healthcare records, to have a better understanding of their own care. Do we do that, or is there a way to do that so that these programs can be shared with families a little bit more directly? And then it would be in a place that they could always go back to. Like, I lost a piece of paper, but there were those great ideas, but I don't know how to get it back. And I don't go see my doctor for another 6 months. And
Also, one thing I don't know why I didn't put on here, but obviously challenges is language, right? We have a lot of non-English speaking patients. So do they feel comfortable going to these programs if they aren't sure if there's anyone who's going to speak their language?
I also see the technology you mentioned about the portals. You know, there's and I think it's one of those opportunities to use the portal, but the challenge is that we use the opportunity in the best way, the most effective way. So it's we're talking about data, taking healthcare data and sharing it, which is really the essence of the whole purpose of it, is for the technology is to be able to take big data, because it's billions and billions, it's millions and millions of patient records, and assessments, and diagnostic information and tests, and using it and being able to share it. Now, you wouldn't share it with other members, but between the caregiver and the patient in the parties within the portal, and then so the benefit is having that ability with telemedicine and being able to set goals that motivate you to, hey, you're better now, your A1C levels are down, you're performing, you're getting where we need you to get to, and look what you've done. Because I think that's the biggest motivation for someone is, hey, you're getting healthier, you're that's going to keep people engaged, I think. So the opportunities there, but again, I think the challenge is making it work on the patient, on the patient to caregiver and care coordinator and primary care. And then on the other side, you have the payer, that these things are getting, that the provider is getting rewarded with that too, so that's kind of some of the opportunities and challenges with the technology and the portal and those kind of things, with the data that we use in providing the care. I guess I should have put something out there. I think I had return on investment or something like that, but that might be, that's a big one.
Yeah, thanks, Dan.
Yeah.
Some of what you're sharing, I'm hearing maybe back to our opportunities conversation, that there's cross-sector opportunities. If you look at technology and data, we just have to figure out, using our strengths, how do we use that?
Yeah, and we're doing it now, but it's tweaking it to what, because it might be a little different depending on age, social determinants of health. There's so many moving parts within that it isn't a one size fits all. Just like transportation, going to these things isn't going to be a one size fits all. It's going to affect different populations differently. And that's where that data piece comes in, where we can, you can take that and use it, then create programs within those populations.
All right, everyone, this is good work. We're getting ready to move from challenges to priorities. If you have the Jamboard pulled up on your own, I think most of you do, everyone does. The fifth Jamboard, 5 of 5, that's going to be where we talk about our priorities. But I'm going to give you a moment if you want to navigate back and forth between the strengths, opportunities, and challenges, and just reread those, see if anything stands out. Let's take a few minutes to do that, because what I'm going to ask you to do after you familiarize yourself with that information again is to come back, and as a group, we're going to talk about what we think our priorities should be to move forward on some of those opportunities, or addressing those challenges, or leveraging those strengths. All right, I see some people have started to get their priorities up on the board. Again, just asking you to think about when you take in everything we've talked about today, and maybe things we haven't talked about, challenges and opportunities that are in front of everyone working on physical activity. Where would you like to see the focus be? Where would you like to see priorities? What needs to be addressed first so that this plan can make the most impact on the people that you're trying to serve with it? Work on getting those sticky notes on board 5 priorities, and then we'll come together for some conversation. I want to make sure that we're getting everyone's thoughts up there. So if you have additional things that if you've added a couple and you have additional ones to add, let's get those added. If you're still coming up with your priorities, take another moment. But let's get something up on the board and we'll get conversation started here in a second. All right, so with this, I'm starting to do something I didn't do with the others. I put these 3 in line over here, the create a map, gather and distribute programming and resource information, create a list of opportunities, because I see those going together in some kind of a theme of putting information together and getting it to people. Providing opportunities fits there as well. Want to hear from the group. Is there anything that stands out to you here, or anything that really resonates and you think that that's what your priority is as well? Promise that I have pretty thick skin, so if there's any criticisms of how I've lumped these together, happy to admit that I'm not the best at doing this in the moment, but I saw 2 themes really. This first theme here, 5, is about communication and sharing information, and then this one here is about really sharing specifically resources and programs.
Yeah, but they're so linked, right? Like you could put a line right between them because we need to gather information and then communicate it out there.
Yes. How do folks feel about that kind of everyone's list of priorities fits under the same umbrella to some extent? Does that feel good? Does it feel like we've missed something if we all have shared something so similar, or does it feel like we're in line and that's a good thing?
Well, I mean, to some extent, it's good that we are all seeing the same priorities, but it obviously hasn't been done yet. So it just shows you how difficult it is to do these things still.
Yeah.
And so along those same lines, look at some of these, there is a map of like bike lanes and trail paths that exist. Mid-America Regional Council is the one who houses it. Obviously, it's hard to find. And it's hard to update. There's an online version, there's a paper version. The paper version's out of date, the online version, where is it? I mean, I can tell you where it is, but obviously everybody doesn't. How do we get that to our patients and families? There's lots of information about programming that can be found through park and recreation websites. But now, I don't know if this is good or bad. People know, just go to the park or recreation website that's near where you live, and then it can be a little bit easier to find it. But it's lots and lots of clicks to get down to where you want to go. Then there's the lots and lots of clicks for the sports programming. Then there's lots and lots of clicks to figure out cost and scholarships, or
I
all
like
of
the
those.
idea. Mhm. I'm sorry. I was going to say, I love the idea of a hub of information. And I think ultimately that's something that would probably happen for the committee, is to take all these resources and these videos that we've had, these great people talking that have done it elsewhere, just combining that somewhere, specific to kind of some of the goals that we've identified, have like a hub. I think somebody had put hub out here. I think that's a really good one.
Did anyone participate in the Parks and Rec? I think it was Parks and Rec sector special event, besides Jen. Okay, so that conversation was about, and Jen, correct me if I'm wrong, but community wellness hubs occurring in parks. And so it was resources going to that wellness hub. You're just promoting the wellness hub. And then all these programs, and I forget, they did it in a variety of different, areas. Like there was like healthcare and, programming, and there were actual activities that took place while they were doing some of these. They were sharing an example of how they sort of brought people to one location versus like a website. I don't know what this group might think of that, or if you haven't seen it, I'd encourage you to go back and watch the recording and think about what would that look like. Is that something we could prioritize in Kansas City for the physical activity plan as a cross-sector implementation project? It sort of gets at a number of the things that are being mentioned here as priorities. And now I also know that you can't have a hub in every area of Kansas City that's convenient for all people. But maybe we could start in one area, target community members in that area, see how they like it, learn from that, and try it in different localities across the metro.
Yeah, I think that we have to centralize it. You're right. And Shelley, I feel like we need to have like a KCPA plan app, and it all comes through there. And you can go to any of the sectors. You can type in your zip code. You can type in like transportation. That's my like future dream.
And I would say, like, if we had like an app or a website, is there some way to just link it to all of these other locations that would just like feed the information in, rather than having to like manually update it? Because I think that's kind of where we lose out on, we're trying to do our, specific jobs and also get this information out, and we, that kind of falls to the wayside, and you get pieces of information, or not like the full story, or just, things that I remember, but that might not be something that people want to hear about.
I'm going to call out Cindy Laufer. So I am really excited that she's listening to this conversation, because one project we are actively working on with the group she represents is around identifying physical activity opportunities within the system. So here in this Kansas City Metro, what organizations are involved in physical activity, and in what sort of way or level, like programming, policy, transportation, funding, those sorts of things. And so this is a great conversation for her to hear as we build out that project. It might give us something to sort of test, and then figure out who wants access to that information and what's the best way to actually access it, like an app versus a database versus, I don't even know what else exists, but anyway, I'm glad you're here, Cindy.
Thanks. Yep, it is helpful.
This is great conversation. We've got about 5 minutes left before they pull us into the room and Jody shares what we've talked about here. Can we come up with a few priorities that we would want the group to take back and focus on? Maybe just wording for them, and I'll be happy to write it down. It's sounding to me like the group has some consensus around a priority on centralizing information and creating a hub. If we were going to put that in some kind of a strategic sentence or something, strategic objective sentence, what would be good wording for that?
I think it would be to pilot a community wellness hub, kind of make it broad.
What do you mean by make it broad?
Well, not put too many details into it, as it's like just a place for communication. It would be that, but it would also be access to other resources from other sectors as well.
And I'd like to add 2 things to that. I would like to suggest pilot a community wellness hub in a park or community setting. Okay, so that's sort of one piece of it. And then I also think there's an opportunity for that from a technology perspective. So you're piloting a community wellness hub in a technological setting that's a place for communication, access to resources, etc. Maybe there's the same. I think of them as different. So I think about, Jen, specifically what you were talking about and what we heard from the Parks and Recreation Sector Special Event. And then I also think about, Cindy, what you're going to be working on with us in terms of a systems map related to physical activity. That's the technological piece that we could build out.
Shelley, can you help me again with, I'm going to make them 2 separate priority notes. What's the one about technology going to be?
I would say pilot a community wellness hub
Oh, is that
from a technology perspective. And Cindy, you can tell me we should reword that in some way that makes it make more sense. And I do want people, as they're looking back to this, to understand that that ties back to the systems mapping that we're trying to do related to physical activity.
I think too, the maintenance, it's been suggested here that, these things become out of date so fast. So it really needs to, that needs to go into it too, as it's created, to ensure that it stays up to date.
So I think about Wikipedia from that perspective.
Mm-hmm.
And Wikipedia, isn't it built on people who update the information? Like there's hundreds, or if not thousands, of people who can add information to Wikipedia. How can we do that? You know what I mean? So it's not Shelley Summer every year. I've got to go back in and update this information. It's all y'all go in and update information whenever you want.
Isn't that just Facebook? Just kidding. But more of a community sourced.
There would have to be an accountability there,
Sure.
either a mass, like, hey, it's time to update, or something to make, just ensure, which I think Wikipedia does have some sort of, because you see like, hey, this isn't good every once in a while or something. But
Yeah.
Yeah, Facebook is kind of a good resource. I mean, a lot of people look to it for small businesses like ours, to have events, to share information and stuff, for news and community things that are going on, rides and community, just community events.
All right, we've got about a minute left. They haven't sent up the minute callback yet, but Jody, I want to check in with you. Is there anything this group can do to support you with language or anything, so that we send you back out into the world to give our updates and you're not fighting alone?
I'm just gonna wing it.
All right.
Are you gonna have the board up so I can like look at it as we go?
That's my plan. I think that I should be able to do that because I'll still be a co-host.
Okay, sounds good.
All right. Well, thank you all so much for this work. It's been really great to be a part of it and to help you think through some of this. I hope that it was useful to you. Shelly, you're the weigh-in champion. Do you feel like there was some useful information that we got out today?
Yes, I
Awesome.
think it's excellent. Great conversation, everyone. Thanks again so much for participating with us today.
All right. See you all in the main room.
Man, we were having a really good discussion. Then we got kicked back here. What?
I know Donald had the best comment of the whole day, and then
He
it was
did.
right in between. Yeah.
Dang it.
But solving all
Yeah, that's how it works. Like I had the most enlightening thing going, and then whatever.
well, let's see. I'm looking. Looks like everybody's back into the room now. So what we're going to do is do a share back to the entire group from each of the individual breakout sessions. So each group gets 2 minutes to share what you discussed. I know that is not nearly enough time, but that's all that we've got time today. There will be additional notes and reports coming out of this that'll be more encompassing, but this will just be kind of a little taste of what happened in the breakout rooms. So we'll start with access room number 1. And I think Jessica was the facilitator there. I don't know who's going to be speaking, but feel free to unmute yourself. And Jessica, if you're sharing a Jamboard or your screen, you can go ahead and do that now too.
Blake is sharing for our group. Blake, would you like me to share any particular screen on the Jamboard, or would you like to just share?
I think I can just share.
Okay.
So hello, everyone. My name's Blake. I'm with the Unified Government Public Health Department. So we talked about access to physical activity opportunities in our community. We had a pretty good group of people. We talked a lot about schools and also like early childhood development. We talked a little bit about engaging with our elected officials and just engaging the community to bring some of those safety concerns forward. At the end of our discussion, we did end up talking a lot about or a bit about safety and perceived safety and actual safety, and really also talked about just creating a culture of physical activity. So we talked a little bit about how like our parks are built. Maybe there is like a baseball diamond or something like that, and you feel like you have to play baseball in order to be in that space. So really talking about how could we talk to our residents and talk to families about you can be physically active in many other ways, just out in your community, and just understanding that that will require some time in building trust and again, building kind of that culture of it's okay to be outside and maybe just ride your bike or walk around your neighborhood and do stuff like that. We also, those were the main things that we talked about. And we did talk a lot about local government. I think we had quite a few people in our group that was involved with that. And really just overall education and engaging with all groups of people. And just, yeah, those were our main points.
Great, thanks for that. Thanks for that summary. And it's interesting, and I think probably everyone is hopefully you're having the same experience I have. Is that we were talking about policy, but some of those same issues came up in our group around community or communication and partnerships. And so as we're hearing these updates, let's kind of think back to some common themes around them all. Access to physical activity was by far the #1 interest area as people registered. So we actually had 2 access to physical activity groups. So the second group was led by, or was facilitated by Zane. And I don't know who's speaking from that group.
I'm going to
That's
share my
me.
screen and invite Jody. Yeah, Jody.
Yeah. So we had a good amount of people from different from different sectors talking, and we definitely have some good collaborative work that we can move ahead with. We were talking about with Kansas City, we have a lot of opportunities because we do have some beautiful parks. We have some good bike lanes. We have a lot of sports teams in Kansas City and a lot of different activities that kids can get involved in. But we kind of had the same discussion, and we ended kind of in the same area with communication. Communication is hard to try to figure out what is accessible, what we have available, how our patients and family and friends can access these resources. So we kind of lumped our priorities into 2 different categories that can kind of be connected as one. So one of the priorities was creating the map of physical activity locations, gathering and distributing of program and resource information. So really this side over here on the right, we really need to create our list, try to find our resources, talk with community health members and all the different wonderful organizations that you guys are involved in, and find that list, create maybe a central hub for that list where you can access it either in a park facility or an online app or website, and then also how to communicate that out. So our other side of the priorities was communication. So talking with our leaders, getting feedback from Kansas City members as well to try to figure out how we can engage Kansas City into this priority as well, and then connecting the 2. So how do we connect both of these to get the word out there?
Great. Awesome. Thanks, Jody, for that update. Let's see, policy was next. So Julianne was the facilitator, and Allison is going to give us a summary.
Yes. Thank you, Allison. Would you like me to share the screen, or are you good to go?
Share it. Share
All
on.
right.
The sticky notes are
I will
beautiful.
share it.
A lot of good work into those.
Okay.
So crazy, Jody, you mentioned all that because we talked a lot about that. Just the Wellness Hub didn't come up. So messaging and communication, getting the word out there, and then also duplicate groups. We also talked about missing the people who need to be at the table to make those changes and just understanding what they actually want. We also talked about trying to get some of those city officials out there to also help us out in the decision makers and convincing them. We also talked about how different languages, back to communication, maybe some of the city officials are not speaking the same language as the community members that are actually requesting. And so they're misunderstanding what's happening. And then also not being aware of those resources. That was one of the other big things that goes back to communication, is who in your agency is going to these meetings to learn about all these offerings, and then what are they doing with that information? Are they taking it back to their work group and sharing those resources with people who can actually utilize those and take action? Staffing and funding, and people actually being able to make the adequate time to follow through on some of these actions as well too. But a lot of it came to communication, messaging, and understanding. And then we also had one on, let's see if I can go find it. Policy. Policy is hard, guys. A lot of us are not policymakers. And so then when those do come out, all the legal jargon and all that, like might be missing the mark on some of that. And then we're also having struggles with restrictions to those policies and getting those city officials to get to the table to understand why some of those policies need to change. So that way we can provide access for all. Did I miss anything? Anyone else in our group? Donald?
You may have mentioned it, Allison, but emphasis on, a coordinating entity for all of these things, that crosses state lines, crosses county lines, et cetera. Thank you.
Yep. Donald, you had a really good one at the very end.
You mean okay, so.
Yes.
So I was just saying, I think Allison brought up a point about having, one group is doing one project, another group is doing another project. We don't want to double dip. So it'd be great if there was a huge text group where we had all of our different partners on this text group. So when one sent out text, hey, I'm doing this project, someone else could be like, hey, I'm interested in that. I don't want to do it again. I'm hopping on, or something like that. That'd be awesome. I think that'd be awesome for all of us.
Yes, just sharing the wheels that you work so hard to create. So that way someone else can also duplicate that wheel and offer it in their area as well, in their community. So thank you, Donald.
Great. Next up, physical activity programming. That was Tina's group, or Tina facilitated.
I did. And I think, is it Chelsea? Are you sharing for us? And do you want to see the screen as well?
Yeah, you can show the priorities.
Okay, great.
So like all the other groups, we had a lot of the same conversations, even though we were programming, partnerships are key. In order to successfully do programming, we need to have the partners that are focusing solely on physical activity, the partners that are focusing on other health aspects, but, fitting physical activity into their work plans and the priorities is really key. And there's some great partnerships already. There's some great facilities with Parks and Recs. And obviously this physical activity summit has brought a lot of those people to the table, which is always a positive thing, and kind of breaking down those barriers for communication, which was another priority, is the communication piece. There's tons of great programming going on in the community, but sometimes the communication isn't widely distributed to everybody. There's a lot of different priorities in programming. So sometimes all that communication, if it's not your focus, it's lost. But finding the new and unique ways to get that communication out. We talked about newsletters and social media, and just the non-traditional ways as well. Another priority is, when you're talking about programming, is to meet people where they're at. It's great to have people come to a rec center, but if that rec center isn't accessible, or that park isn't accessible for everyone, then sometimes that programming will fail. So really making sure that we're meeting people where they're at, and to engaging the other businesses or organizations in that community. We talked about, a grocery store that's a popular place, maybe a great partner to have, even though it's not physical activity, they can promote it. We can hold something at their grocery store that would promote physical activity. So all of those things, just inviting and inclusive, and meeting different languages. We talked a lot about signage, and how having different signages within parks or community facilities would be great. QR codes that take you to a different website, or having signage in different language just makes programming accessible to all different types of audiences. And then beneficial, right? So meeting parents and kids all together, all different ages. And, I think that's about the key things. And really, the last piece would be the innovative programming. Thinking outside the traditional activity, walking, gym, really trying to come up with some innovative, engaging programming. COVID obviously has allowed people to become very comfortable with the online world and doing things virtually. So how can we kind of still capitalize on reaching audiences using that method, as well as having, those central locations and parks and things that we can reach people at. So I think that's about it. And obviously there were several other conversations, but those were the key things we talked about for priorities for programming.
Great, thanks Chelsea for that update. And last group to share is professional development education. Sai was the facilitator there.
Yeah, and I think James was going to share for our group. James, would you like me to share my screen? Or are you comfortable where you're at?
Yeah, if you want to share that kind of last slide, I think we can go over it from there. Yeah, so my name is Jay Robertson. I'm one of the sports medicine docs at Children's Mercy, and we're basically talking about different ways to educate amongst our groups and even down to families and kids. And what we kind of decided was that there's got to be some collaboration amongst the different sectors to really find out, make sure we're really educating the right people, the people who want the education, and making sure that we're tailoring the education to whatever group we're talking to. And as I've seen, communication and different language kind of becomes a theme in different ways, I think for all of our groups. But one of the things that we're really talking about is making sure that we aren't using jargon when we're talking to people, making sure we're using basic language that can educate everybody without people being confused or unsure of what acronym we're using and things like that. And that's something that needs to happen regardless of what group is being educated. But I think we've got within our whole KCPA plan a lot of highly educated and engaged folks who would be great resources to provide education. So I think that's where we've got some really good strengths in this group, and just making sure that when we do those implementation things that we do bring in the different sectors. Also, a big part of education is making sure people can actually get to it. So making sure that we give plenty of different opportunities, whether it be in person or online or on demand kind of education that we can get everybody involved with. And obviously different parts of our states and different parts of the region have different access to those things. So we really want to make it accessible to all. It was a really big point that we wanted to make. And then another thing that we really wanted to make sure is that we could engage leaders in the organization. So in a business or in a school district or anything like that, to actually give people the time to do this and talk about costs and how to mitigate that for the individuals and maybe get it onto the group. So that's most of what we were talking about.
Great, thanks Jay. Thanks to all the groups for great summaries. Thanks to all the individuals for participating in the conversation. Obviously, that was just a snippet of what happened in all the breakout rooms. So we'll spend the coming days, weeks, and even months, really kind of better understanding what some of the themes and takeaways were from all of these breakout sessions. And that actually leads us to the end of the program and the next steps. Pull up my slide here. Sorry. So we've been recording all these sessions. We've been taking excellent notes. Of course, we have all the Jamboards from the individual presentations, and we're going to distribute all that information back to you, like I mentioned. We'll do that in several ways. One way is we do have a Kansas City Physical Activity Plan YouTube channel, and Katie might be throwing that in the chat if she hasn't already. This is where we have recordings of all those special events that we held in August and September, in addition to where we'll post some of the discussions that we had today. We also really try to prioritize communication through sectors that you've signed up for. So there are monthly sector newsletters that provide really good summaries of the things that we've talked about. And I'll show you in just a second on how to sign up for those sector updates and that communication in just a minute. And that brings me to, we hope that you join a sector working group. This is where the action of the Kansas City Physical Activity Plan really takes place, is at the sector level. And so the easiest way to be involved and to help with collaborative action across the plan is by getting involved in your sector work group. We'll show you on the next slide how to do that, but I strongly encourage you to sign up for one of those groups so you get those communications. Additionally, if you don't want to join the Kansas City Physical Activity Plan, if you don't want to join a sector work group, that's fine. This plan is a free plan. It's a publicly available plan. We would be ecstatic if we learned that some organization or some group all of a sudden went ahead and implemented strategies 24, 25, and 26 because they were part of some other working group from some other organization and were able to do it. That is what we want to do. Because if we get enough people implementing the plan, we feel we can make long-term changes in opportunities for physical activity in our region. So here are the upcoming sector work group meetings. So early childhood, healthcare, parks and recreation, sport, mass media and schools all have dates set. We have a couple other sectors that currently don't have meetings set, but will. But again, if you sign up for sectors, you'll get notified of when those future meetings happen. And again, Katie, I think, has put in the chat how you can sign up for those groups. And actually, it's on the screen right there too, Kansas City KCPhysicalActivityPlan.org/sector work groups. And with that, that concludes the 2022 Kansas City Physical Activity Summit. We're only 1 minute over. Thank you all for all of your work today. Thanks for joining the conversation, contributing to the conversation. We really appreciate it. And most of all, thank you for all you do for health in our region. And with that, I hope you enjoy the rest of your day and that we see you in a future sector work group meeting. Thanks, everyone. Have a good day. Oh, sorry, last one. I screwed up. Eval. This is the last slide. So we'll leave with this slide up. Please contribute. We do take your evaluations to heart. So please, if you have comments, not only about today's summit, but also the work in general, feel free to fill out this evaluation. And we look forward to hearing from you. Thank you.
Bye, everyone.